Okay, let me start with this. Imagine waking up every morning and checking your phone not for the weather, but for a toxicity report. That's life right now in BC's southern interior. Wildfires aren't just a headline, they're the air people breathe, literally. And here's the kicker, even as smoke slightly decreases in some areas, officials are still slapping a very high-risk label on places like Kamloops. I mean, what does that even mean for someone walking their dog or coaching a soccer game? Let's unpack this. First, the numbers. AQHI levels at 10 plus or 150 to 400 pm 2.5 sounds like a math problem until you realize these are the invisible particles sneaking into lungs. But here's what bugs me. When they say everyone's at risk after 24 hours, who's actually tracking that exposure? We're talking about microscopic poison that lingers, right? So when a parent in Kelowna keeps their kid indoors for a week straight, are they protecting them or just delaying the inevitable? And why are we normalizing this? Officials recommend air filters and 95 masks, staying indoors. But let's get real. How many people actually have high-grade air filtration systems? My cousin in Vernon bought one last year, and it cost him $800. What about renters? Low-income families? This advice feels like telling someone in a flood zone to just buy a boat. It's tone-deaf. And masks. Good luck convincing a construction worker to wear one all day in 30 degrees Celsius heat. There's a privilege gap in these solutions that nobody's addressing. What fascinates me most is how this mirrors climate patterns globally. BC's wildfires aren't isolated, they're part of a domino effect. Siberia's burning, the Amazon's burning, and now here we are. But here's the twist. The air quality maps aren't just showing smoke, they're visualizing our collective denial. When a moderate risk zone like North Okanagan gets complacent, while Kamloops suffocates, it reveals how we compartmentalize crises. We're treating symptoms while the planet screams for an intervention. And let's talk about the long-term health bill. Right now, officials mention heart disease patients and pregnant women as high risk. But where's the data on chronic exposure? If a 60-year-old in Salmon Arm develops COPD in 5 years, will we trace it back to these summers? Or will it just become another unexplained statistic? This isn't just about today's smog, it's about generational consequences we're sleepwalking into. Here's my hot take. The real story isn't the smoke itself, but how we've weaponized individual responsibility against environmental collapse. Closing windows instead of confronting emissions. Handing out masks instead of fixing root causes. Maybe these air quality warnings aren't warnings at all. They're participation trophies for a system that's already failed. What if the bigger crisis isn't the smoke, but our inability to see it as a symptom, not the disease? So next time you scroll past the wildfire map, ask yourself, are we the ones choking, or are we the ones lighting the match? Because if Kamloops is a 10-10 on the toxicity scale, what does that make the rest of us?